So just to get to review or to summarize, the key principles of chiropractic are, again, very similar to the principles we're going to see throughout the majority of these complementary therapies that we're going to discuss over the course of the next few months. One is the vitalistic principle, which basically says that a human can keep themselves healthy as long as there aren't any barriers to the full expression of that human's vital functions. So really what we're saying here is just the body has the ability to heal itself from within, right? So oftentimes we, at least in the naturopathic profession, we oftentimes refer to as removing the obstacles to cure. So and that's sort of the job of the naturopathic doctor. And in this case, I would say the chiropractors would say a similar thing. The tools they use to remove those obstacles may be different, but the goal here is to basically get everything out of the way in order to allow the body to heal itself. And the body has the ability to do that, right? That's kind of one of the principles that you have to agree to if you're going to kind of go down these paths, is to say that the body is able to self-heal, right? And what we're trying to figure out, and I think it makes a lot of sense, is to try to figure out what's in the way and how do we get around that. And so the osteopaths might look at it one way, the chiropractors are going to look at it another way, the naturopathic doctors are going to look at it another way, the herbalists and the homeopaths, and everybody has sort of their maybe a different sort of toolbox, but the net goal is the same, and the agreement is shared that the body has the ability to heal itself. And then another thing that the chiropractors are big on is recognizing that the body is a network of systems that are all interconnected. So when you hear that term, it's all connected, right? That is true. Everything is connected somehow. And one of the master systems that allows for this interconnectedness of the body, or the ability of the body to communicate with another part of the body over a distance, is the nervous system. I think I said earlier that really our two mechanisms of distance communication are the nervous system and the endocrine system. And since the chiropractors are focusing on the spine and all the nerves that kind of enter or exit at those segments of the spine, they're really into the nervous system. All right, so I took some core chiropractic principles out of a textbook called The Fundamentals of Complementary and Alternative Medicine. And these core chiropractic principles were: one, structure and function exist in an intimate relationship with one another. 2, structural distortions can cause functional abnormalities. 3, vertebral subluxation is a significant form of structural distortion and dysfunction that can lead to a variety of functional abnormalities. And the 4th principle is the nervous system occupies the main role in restoration and maintenance of proper bodily function. So those are the core chiropractic principles. I would say that we could add a couple others probably as well. So basically we're saying that what they're saying is that when there is a subluxation, that can influence the entire body's function, basically by interfering with the neurological system, which is one of the mechanisms of communication. And so the chiropractic treatment then is going to be specific, and it's going to aim to correct that subluxation, right? So the focus of the treatment is the subluxation, and a definition, not a perfect definition, but a definition is a subluxation is just, it's not a full dislocation, but it's a dislocation, a slight dislocation in a joint comprised of 2 vertebrae, right? Vertebrae stack, like I said prior. So they stack on top of one another, and if they're a little bit dislocated, that's what a subluxation is. And remember, the spinal nerves enter into and out of exit the spinal cord at the levels of these vertebrae, and the nerves that are going in and or coming out kind of like wedge between these bones. And if the joint's out of whack a little bit, then that will put undue pressure on potentially the nerve, right? If the vertebrae is out of whack, that could put undue pressure on the spinal cord itself. And if we go rewind way back to Palmer, he mentioned the first Palmer, D.D. Palmer, he used the term, if you remember, the innate intelligence. So my take on innate intelligence and what they were trying to kind of like get there is that that there's like this energy that comes from above and basically goes through the spinal cord and exits and energizes our tissues, pardon me. So that's kind of my take on what he was getting at with this innate intelligence. So it's like this higher level of energy, right? That gives life to the body, if you will. And then that flow of that energy flows through the central nervous system and then ultimately, down the spinal cord, which is part of the central nervous system, and out. And by messing up those joints, that's what causes all these problems. So here's another more recent quote by the chiropractor William Meeker, and who was the dean of research at the Palmer College of Chiropractic. And he says, some people think the bones and muscles are there to carry the heart and lungs, but we see it the other way around. We like to say that the viscera is there to support the musculoskeletal system, to make sure it works right and allows us to be mobile on the earth. Most of the body is really taken up by the bones, joints, and muscles, not by the heart, lungs, and the gut. So this is, again, what chiropractors, this is their philosophy, right? That most illnesses occur as a result of disturbances in the nervous system, right? So where they treat, and all their treatments are going to be, at least in some way, shape, or form, are going to be focused on the spine. Now, the chiropractors I think lens has widened quite a bit in recent years, and I mean, up until some point I would have been fairly confident to say anytime somebody goes into a chiropractor they're going to get adjusted. I don't know that would be true currently because of the fact that people are sort of expanding because of the fact this complementary alternative, or whatever you want to call it, medicine is becoming more mainstream, not mainstream, but more mainstream. There are more health professionals doing kind of the same sorts of things around diet and lifestyle counseling and those kinds of things. And so I think that's really moved into the chiropractic profession to such a degree that I don't think it would be that hard to find a chiropractor that might not even adjust somebody at their visit because they're doing all this other stuff. Historically, I don't believe that would have been true. Okay, so but these subluxations, they happen just because that's just what happens in life, right? It's a part of normal living in any culture. But the fact that we have such an increase in our sedentary state, right? The modern lifestyle is very sedentary, and that is potentially putting unnatural strains on the body, including the spine, and causing subluxation. And we're also, and because we're so sedentary, this same kind of logic can be used to apply to the fact that potentially we're becoming less flexible because we don't move around as much. I think there's some that makes kind of a lot of sense to me, at least. Okay, so in poking around, looking at some of this history of chiropractors, and this profession, and I should say, knowing a fair number of chiropractors from different perspectives, I would be remiss to not point out that there's kind of this dichotomy that's or a fracture, if you will, maybe in the chiropractic profession. And so I went looking for a little bit of, I went looking for an explanation of this, and found a few different explanations. But what was interesting in my digging is that there's this reference made to the straight chiropractors versus the mixers, and that this is sort of the chasm between these groups, and the controversy over the straight versus mixers kind of chasm is the feeling about how much the chiropractic practice should focus on symptom relief. And so the chiropractors that kind of fall into the straight camp are confining their practice to really subluxation. So we might also call these traditionalists, right? So that's what the chiropractic profession is built on. That's what the belief was, that all illness results from subluxations, and manually adjusting the sublux vertebrae is the treatment. And that's where it ends. Those would be the straights. Then you get the mixers. And so the people that fall into the mixer camp are probably most oftentimes still talking or looking at these subluxations. But in addition to manipulation, they're also advising patients on things like diet, nutrition, exercise. They're probably using supplementation, those kinds of things. So they're not just going for the subluxation. So those are the mixers. So I guess you could say that in the mixer category, we're really broadening the scope of practice, and they're including many other sort of modalities that aren't not historically chiropractic into their treatment plans. All right, so before we wrap up, I want to look at some theory and theoretical kind of constructs and some practical applications of the chiropractic profession. And I think I've said some of this before, but I want to move towards like when you would want to potentially get a chiropractic adjustment and when you wouldn't. Okay, so historically there was this theory that basically it was held by the pioneer era chiropractors, the Palmer group, that their adjustments basically just moved vertebrae that were out of line back into line, and that relieved the pressure that was caused by the bones pushing on the spinal nerves, and that was why people got better. Like the analogy of the garden hose, right? You kink the garden hose and the water doesn't flow through it, right? If you unkink the hose, the flow is restored and the water flows through it. So that was sort of the early theoretical construct of this profession. Obviously, there are some limitations to that theory, and some things that cannot be resolved completely by, or aren't resolved completely by just moving the bone, right? Or can't be explained by just, this sort of premise. So alternatives to this kind of bone out of place theory have been posed, and the main one is the theory of basically intervertebral motion and segmental dysfunction. So this idea sort of was slow to get going, but it was broadened relatively quickly, as we moved through the 1980s and then into current time. So this theory also helps us to kind of understand vertebral subluxation and what that's all about. So essentially, the motion theory holds that if you lose your proper spinal joint mobility, right, so your spinal joints become stiff, not necessarily positionally out of place, but when the spinal joint becomes stiff, that really is the key factor in this this issue, right? They call it the cerebral subluxation complex. And it basically holds that the subluxations are always going to involve more than one single vertebra, right? And instead it's more of like a segment, right? So there's a segment of dysfunction. And when that segment is out of whack, it interrupts the dynamic relationship between, everything, but also between those two joint surfaces that meet up, right? So sometimes they refer to that when they're kind of stuck, they refer to that as a fixation, when the joint movement is stuck. And that might be something that you've heard before if you've ever been to a chiropractor. So anyway, that's kind of what it all comes down to, fixations and subluxations, right? And how it affects the spine. So let's think for a minute about, what do I have on the next one? Okay, so before I go into the techniques, we should think about like when should we think about getting a chiropractic adjustment, or if we were a chiropractor, when would we think about giving one? And is there any reason why we might not want to, or any conditions where we might not want somebody to be getting a chiropractic adjustment? So, sorry, my brain just took a mental vacation for a second there. So I think the biggest thing is, most people come in because they have pain, right? And so if somebody comes in for pain and they are thinking about having an adjustment, when do you do it and when don't you do it? And I'm not a chiropractor, so I'm not going to be able to answer that question, in terms of the algorithm, but I can tell you logically, there's certain things that you would sort of think about. You would want to make sure that it was safe for them to have an adjustment, and whatever, and if you think that it's going to be effective, at least that's how I would approach it. Could this be effective, and is it safe? So I guess the thing I really want to emphasize is when it's not such a good idea to have an adjustment. I personally would be a big fan of having x-rays done before I got significant adjustments, especially if I didn't really know the health of my patient. And I think that most chiropractors probably do that, although I don't know that they all do. But anytime you have any kind of like bone weaknesses, so bone infections, joint infections, cancers, oftentimes people who have inflammatory arthritises are probably not great candidates for adjustment. So those kinds of things, really. It seems like when I found the list of, and then you'd have to use common sense, like obviously somebody who has osteoporosis or something along those lines, you're going to be very cautious with that. So in terms of the techniques that chiropractors use, it's manual medicine, very similar to the same sorts of techniques we talked about in the osteopathic unit. Probably the most common is adjustment, right? High velocity, low amplitude thrusting. There is, the same kind of like flexion, distraction techniques. They have also different types of manipulations similar to what we talked about when we looked at cranial sacral. There's an interesting type of, and I don't know very much about this, and somebody out in our virtual space might have more knowledge on network chiropractic. I know a lot of people sort of like network chiropractic. So network chiropractic is where they, in most cases, the practitioner has a little tool that oftentimes is called an activator. It's kind of like a spring-loaded pointer almost. And with network chiropractic, what the practitioner does is they lightly tap points where the vertebrae attaches to the meningeal sheath. And it's supposed to give a lot of, it's supposed to increase mobility, decrease rigidity of these spinal segments. At least that's how it was explained to me. But it's not high velocity, right? So there's no risk there, especially if somebody potentially has maybe some bone weakness or something along those lines. So there's all kinds of offshoots in terms of manipulation and types of manipulation. And like I said, I'm not an expert on that, but we could dive into it a little bit. And some of you probably have some experience, probably more experience than I do with chiropractic. I was just going to say something else. The other thing that again, depending on where the chiropractor falls in their straight versus mixers kind of a philosophy, they're probably going to be doing, if they're in the mixer camp, some physiotherapy, using those kinds of things in their office as well. Many of them will incorporate massage, so they might have massage in their office, and then of course diet, lifestyle, counseling, and all of that. Supplementation is probably a part of it as well. Okay, so I have posted for you in your module for this week. I searched YouTube, my go-to source for all information these days. I searched YouTube and I wanted to find like a chiropractor talking about chiropractic. And there's a bazillion out there. And I found one that I thought was pretty good. It's a little on the long side. I think it's 45 minutes. But I think it's good because he goes into some history and talks about, the founding fathers of chiropractic. He's I'll be interested to hear your take on if you think he's a straight or a mixer, if we were to guess, if he were to fall into one camp clearly in one or the other. But from my relatively limited experience with chiropractors, although I have met quite a few chiropractors and we seem to end up at conferences together a lot frequently, I think he's a pretty good representation of the kind of run-of-the-mill chiropractor, sort of the average, mid-road chiropractor in his philosophy and his and the way he thinks about how chiropractic works. And it's nice to hear that coming from a chiropractor. So I posted that in there for you. So please set aside a little bit of time and check it out. Okay, and next week we are going to talk about naturopathic medicine, my favorite. So we'll be doing that next week.